All right, thank you so much, Dr. Zhang. We've seen in these first two talks how VR is really changing the game of pediatric care. I'm sure we'll continue to see that, probably from a different lens with this talk from Dr. Chogle. Dr. Ashish Chogle is an associate professor of pediatric gastroenterology at the University of California at Irvine. He's also an attending physician at the Children's Hospital of Orange County. Please, floor is yours.
All right. So good morning, everyone. So we'll switch gears a little bit. Now we are going to talk about the caregivers, we're going to talk about the parents, and how we can use extended reality for that group of population. So for a moment, imagine that you are the parent of a sick child in the hospital, and your child has been recommended to get a procedure done to have a medical device placed in their body, like a feeding tube, which is a gastrostomy tube, or a tracheostomy tube for breathing, or a IV line for feeding or giving medications. In the current state, the way the parents are consented for these procedures and the way the parents are trained in most hospitals to take care of these medical devices is inadequate and, in my opinion, is flawed. So this is where my efforts came in to use extended reality to fix these issues. So before looking at the challenges, let's learn about the definition of informed consent. So informed consent in the true state is the process by which the parents are given information about the procedure, they learn about what is going to happen to the child, the risks, the benefits, and the potential complications of the procedure. And then the parents voluntarily give consent or agree to have that procedure done. Informed consent is a vital part of healthcare because it respects the parents' or the patient's autonomy and also respects the patient's rights to make an informed medical decision. So the problem with informed consent, or the few problems that we have noticed, is most families and parents do not understand the medical jargon or the complex medical terminologies when we are talking to them about the medical procedures, and this is even worse if the literacy levels of these families is lower. There is, of course, a language barrier that exists. So if a family does not speak the local language, they are not able to understand our explanation of the procedures properly, or even if they understand, they are not able to express their concerns to us. There is also a problem with the limited availability of translation services or interpreter services in most healthcare settings, or I would say a lot of healthcare settings. There exists a power imbalance between the caregivers, the healthcare providers, especially the physicians, where the parents perceive the physicians as figures of authority, where they have extensive knowledge, they know a lot about their field, and they feel compelled that they should just agree with the physician. If the physician makes a recommendation, the parents don't want to be seen as disrespectful or uncooperative, and they just agree with whatever the physician tells them, even if they have not completely understood the process. Consenting usually takes in a time-pressured environment. For me, I'm a pediatric gastroenterologist, so I do a lot of these procedures, and when I walk into the patient room, I have a few minutes to explain the procedure. I have a few minutes to answer the concerns, and in a few minutes, I'm off to do my next procedure. So there is a very small amount of time that I spend with the parents or the patients explaining things which actually deserve to be explained for a longer time. And even with the parents, they feel guilty if they're asking too many questions, because that delays the OR, that delays their kids' procedure. So I think even from the parent side, there is a bit of a pressure to just sign the consent form and get things going. Sometimes I'm explaining the procedure and they're like, okay, just give me the consent form. So they, some of the parents don't even want to waste that much time listening to everything that we have to say. And there are medical legal implications of an incomplete consent. That means if I have not explained the entire procedure, if I have not explained the risks and the benefits and the complications of that procedure, and I have not documented that I have performed a complete consent, if the kid suffers harm during the procedure or as a result of the procedure, the parents can bring a medical negligence lawsuit against me. If I have documented a completed procedure, a completed consent, I am sort of protected against that medical negligence lawsuit. So this is, the informed consent is also an important medical legal document. Different providers, different physicians will provide different levels of information about the procedures to the parents. Some of them might not disclose all the risks and benefits. There might be conflicts of interest. There might be personal biases in the limited divulgence of information. One of the biggest omissions I have seen in this process, especially with procedures which I described earlier, where a medical device is placed in a kid's body, is no one tells, or very few people are told, what happens after the procedure is done. What happens once the procedure is done and the kid is taken home? Because that is an important piece of information. Once these devices are placed, especially the gastrostomy tube or the breathing tubes or the IV lines, there is a lot of burden of care for the parents. These parents feel their life is taken over by the care of these procedures. I have met parents who have given up their careers just to take care of the kid. And it is very stressful for these parents, and no one sits down with the parents and goes over, okay, what do we expect you to do once the procedure is done before the procedure is performed? And I think this is a vital piece of information that should be given to all these parents so they can take all the information into account before they consent for any procedure. So in the current state, the way device training exists in most hospitals, I'm not saying all hospitals, some hospitals have an added layer of medical training, but in most hospitals, the bedside nurses will teach the parents how to take care of these devices. And the parents learn about the procedure care from these nurses and then are sent home with printed out instructions or a binder or a brochure, and they're told, okay, bye, we feel you're adequately trained, good luck. Now let's listen to this parent who underwent a typical experience of her kid getting a medical device, and then what happened later.
When we left the hospital, I had one training session, which lasted about a half hour. And I really have watched the nurses a lot, but it's just night and day when you're doing it on your own with no support. So I had one half-hour training session. And then you get a big binder, but that's a little overwhelming where to even start in the big binder. So you don't have the muscle memory that nurses have too, of the nurses do everything really fast. They grab this and they grab that, then they scrub this, and they're just moving so fast that you really need almost baby steps to get through it to build up that muscle memory.
So you can imagine the anguish of most parents when they are sent home ill-prepared, and there are more issues with that process. One is different nurses have different levels of training for these medical devices. They have different levels of expertise. Unfortunately, in the current scenario where there are a lot of traveler nurses going from one hospital to the other, they might not even have the correct expertise to train these parents, but they are put into the position where they are supposed to train the parents. There are time constraints. Nurses are busy professionals. They have a lot of patients under their care. They're running from one room to the other. They are being paged. They're entering orders. They're charting. They're administering medications. And in that chaos, they're supposed to sit down with a parent and spend even half an hour teaching them. So it is kind of unfair for the nurses as well, because in their busy schedule, they have to fit in the parent education. And current scenario with the nursing shortage, this is further, we feel the pain further, where there is not adequate time for these nurses to do their job with sufficient justice. And from the parent's perspective, imagine you being a parent of a child, a sick child in the hospital, and I can tell you from personal experience, my child, when he was born, he was in the NICU for a week or so, and I was exhausted. I was at my wit's end. I was trying to figure out what's going on. Even being a physician, I was stressed and anxious, and I had not slept for a week. And by the end of the week, my brain was fried. I couldn't process information. I had to, literally ask for help from my friends to even help me out, come and relieve me for some time. my wife had just delivered, so she was not in a place where she could help me. So these parents are a lot of times incapable of absorbing and retaining the information that is given to them at bedside. And that becomes a problem when all you're relying on is bedside education, maybe for half an hour or even an hour from a nurse. And for that parent to, get everything right and then go home and do stuff for the kid, it's a difficult situation. So to give you a perspective, about 1 million children are discharged from US hospitals with medical devices placed in their body each year. And these kids have frequent ER visits, frequent hospitalizations, frequent calls to the healthcare teams because of complications of medical devices. In a study, it was shown that 30 to 40% of these visits could have been avoided. And a big factor that was shown to influence these visits was the lack of parental efficacy in managing these medical devices. Now, these are the kinds of phrases that I've heard from parents when I see them for follow-up after the procedures are done, and they are just scared. They want to go back to the safety of the hospital. They want to go in the warmth of the care of the nurses who were taking care of their kids, and they just don't feel comfortable at home with their medically complex kid. They're scared that while taking care of the device, especially say the breathing tube, when they're changing that tube, they might just kill that child. They're scared and anxious that while taking care of the central IV lines, especially the lines which go near the heart, that they might introduce a life-threatening infection and they might hurt their child irreparably. So once we started seeing this pattern of issues, we came up with a solution. So we created CareXR, which is a virtual reality based and a mobile based educational system for parents, and then we are also using for nurses, where it consists of 4 components. So the first component is an interactive procedure video. I'll show you a sample clip of the video, and then I'll tell you more.
Look at how the percutaneous endoscopic gastrostomy tube is placed. This tube henceforth will be referred to as the PEG tube. The tube placement is performed under anesthesia in the operating or procedure room.
So you can see that this is a simplified version of the procedure in different languages, which gives the parents more details than say a simple YouTube video, where the parents are able to interact while the procedure is being shown. It gives them the ability to get answers to the most commonly asked questions, and it gives them the ability to ask questions to the care team, their home care team, if that arrangement is possible. And it also gives them the ability to acknowledge that I have seen the procedure, I have understood the risks and benefits, and once they have done that, we can actually take a copy of that acknowledgement and put it in the patient's chart as a part of their informed consent. And now imagine if we are able to send a copy of these videos ahead of time to the parents, where they can view this in the safety of their home and the comfort of their home. They understand this procedure very well, understand the risks and the benefits, and then come for the procedure, and then ask relevant questions to the physician at the time of the procedure, so that no one's time is wasted. The physician is still running on time, they're just being asked only the questions which they didn't, the parents didn't understand. I think that'll be a better process than what is being done currently. So we have also created training videos by professional nurse educators like Wanda Rodriguez. Wanda, say hi. So Wanda is a nurse educator at Children's Hospital of Orange County, and with the help of nurse educators like Wanda and other physicians, we have created evidence-based content for the care of the devices, for the use of the devices, how to troubleshoot the devices, how to identify complications early on, and when to reach out for help to the healthcare professionals. And I'll show you, we have this content in other forms as well, but we have made this content available in various languages to overcome the language barriers. and of course, I wouldn't be talking here if I didn't have a VR component to my platform. And this is the virtual reality component where the parents at bedside wear the headsets. They're transported into this beautiful room with a virtual child, and now they are able to practice all the steps that Wanda taught them, and keep practicing until they get comfortable. I'm not saying that they're going to be absolutely professional at doing it, but they'll be at a stage where they're comfortable and confident that, okay, I got it, and I can now go home and take care of my own child. And they have practiced on this virtual child, so that they are, for the first time ever, they are not practicing on their own child, because that's what they feel, that, oh, it's almost like I'm practicing on my own child. If I make a mistake in even one step, I might hurt my child. So to carry this experience home, because like I told you, parents sometimes are not in a mental state where they are able to absorb information while they're in the hospital. So we have transported all this content into a mobile platform. So the parents take all this information home. They have Wanda at their fingertips at 1 a.m. in the morning. If say one of the devices gives trouble, Wanda is there to help. They can refer to her video and they can troubleshoot whatever's going on. If not, they can reach out to the hospital or the healthcare professionals. Now, one more advantage of this platform is, in the hospitals, only a few people are allowed with the family, with the patient or the child. So what about the parents when they go home and they are working? What about those parents? Those kids are usually being taken care of by the grandparents, by their uncles, siblings, aunts. So this platform provides an opportunity for those extended caregivers to get trained at home as well. I had a mother who told me that she never attended social events or parties for 14 years until her kid had a central line and a G-tube, because she didn't trust anyone else in the family to take care of the child, because no one else was trained for those devices. So, we are hoping to avoid such situations with this device. So now can you, okay. So we showed our platform to this previously anguished mother, and we wanted to see how her perceptions changed or what she felt about our platform.
I think CareXR, what I love about it is it allows you to practice those sequences and develop a little bit of that muscle memory. And if you get it out of sequence, there's no real consequence. It's really reassuring, as opposed to, trying to get it right when you've really only done it once or twice. You have that muscle memory of, okay, now I do this, then I flush, then I do this. That's really important, that CareXR lets you practice. I mean, this is big stuff. You kind of want to practice.
So I think it's now time to recognize these issues, end the status quo in the way we perform informed consent and medical device training for parents. And I hope that with more versions, or with our versions of extended reality, to improve the process of informed consent, to make it a true informed consent, to take the medical education for caregivers to the next level, and give these poor parents confidence and the skill sets and the peace of mind when they take their kid home from the hospital. I think it's valuable. And I would like to thank everyone involved in this passion project of mine. And this project came from a place of real concern and a real clinical issue that we identified. And nurse educators like Wanda, BioFlight VR, which is, they are a company based in Hollywood who's doing this animation for us, and of course Innovation Lab team. I'm very, very grateful to them that they supported this vision and the clinical mission that I embarked on. So thank you.